You are swimming through crystal clear water. The coral is stunning. And then you brush against something. Within seconds, your hand feels like it is on fire. Not burning, on fire. And that is just the beginning. What actually happens to your body after a lionfish sting? And why do some victims say the pain is so severe they would rather lose the limb than live through another minute of it? That answer is more disturbing than most people expect. And by the end of this video, you will understand exactly why this beautiful fish is one of the most medically dangerous creatures in the ocean. The lionfish is not aggressive. It does not chase you. It does not hunt humans. But it is extraordinarily good at looking like something harmless, or even beautiful. Those flowing feathered fins are a warning dressed up as a decoration, and most people miss the message entirely. Hidden inside those elegant spines are up to 18 venomous needles, 13 dorsal spines along the back, 2 pelvic spines, 3 anal spines. Each one is sharp enough to pierce a wetsuit. Each one delivers venom the moment it breaks skin. The venom glands sit at the base of each spine, not at the tip. When the spine punctures you, pressure forces the venom up the groove of the needle and directly into your tissue. It is a passive system. The fish does not even have to try. Most stings happen by accident. A diver reaches into a crevice. A snorkeler brushes against one without seeing it. A fisherman grabs the wrong end of a catch. The lionfish was just sitting there. You came to it. The moment a lionfish spine enters your skin, the clock starts. In the first few seconds, you feel a sharp, localized pain at the puncture site. It is immediate. It is intense. But this is nothing compared to what comes next. Within 30 seconds to 2 minutes, the venom begins spreading through your tissue. And survivors describe what happens next in terms that are almost impossible to believe. The pain does not stay at the sting site. It radiates. It travels up the limb, from finger to hand to wrist to forearm, like something is burning you from the inside out. Some victims describe it as a deep, crushing pressure combined with a scalding heat that no position can relieve. Within minutes, the tissue around the wound begins to swell. The skin turns red, then sometimes a deep purple. The area becomes so sensitive that even air touching it feels agonizing. Doctors who have treated lionfish stings, and some who have experienced them personally, consistently rank the pain as among the worst they have encountered from any marine animal. Not the most lethal, the most painful. So what is in the venom, and why does it hurt so much? Lionfish venom is a complex cocktail of proteins and enzymes. Unlike snake venom, which is designed to begin digesting prey, lionfish venom is primarily a defensive weapon. Its job is not to kill. Its job is to cause pain so severe that whatever touched the fish immediately lets go and never comes back. The venom attacks the tissue directly around the wound, triggering a massive inflammatory response. It disrupts cell membranes, causes local tissue damage, and fires pain receptors at an intensity your nervous system is simply not built to handle calmly. In more severe cases, especially in people with underlying heart conditions, lionfish venom can affect the cardiovascular system. Temporary drops in blood pressure, irregular heartbeat. In rare cases, the venom has been associated with temporary paralysis of the affected limb. There have been documented deaths from lionfish stings, though they are uncommon. Most fatalities involved secondary factors: drowning after incapacitation in the water, severe allergic reactions, or infections that developed afterward. Here is one of the strangest things about lionfish venom, and one of the most important pieces of information if you are ever stung. The proteins that make up lionfish venom are heat-sensitive. They begin to break down at high temperatures, which means that submerging the wounded area in water as hot as you can tolerate, without scalding yourself, actually degrades the venom and significantly reduces pain. Survivors report that this treatment can drop the pain from unbearable to manageable within minutes. It does not fix the tissue damage, but it buys time and reduces suffering. Most first aid guidelines for lionfish stings include this step. Meanwhile, the wound itself needs careful attention. Sometimes spine fragments break off and remain inside the tissue. If they are not removed, infection sets in rapidly. The warm, bacteria-rich marine environment means that even a small puncture can become seriously infected within hours. Necrosis, the death of tissue around the wound, has been documented in severe cases. The area around the sting can blister, turn black, and in extreme untreated cases require surgical debridement. Most treatment involves pain management, hot water immersion, wound cleaning, and antibiotics. There is no commercially available antivenom for lionfish stings. You manage the symptoms and wait for your body to process the venom. Here is why this matters beyond just one unlucky swimmer. Lionfish are native to the Indo-Pacific, the waters around Southeast Asia and Australia. They have no natural predators in the Atlantic or Caribbean. And somehow, beginning in the 1980s and accelerating through the 1990s and 2000s, they established themselves across the entire Caribbean basin and up the Atlantic coast of North America. Populations exploded. A single female lionfish can release up to 2 million eggs per year. They eat almost anything. They breed year-round in warm water. And because local predators have no evolutionary history with them, almost nothing hunts them. The ecological damage is significant. In some areas, lionfish have reduced juvenile fish populations on reefs by up to 70%. The reefs that entire fishing communities depend on are being stripped. The response in many Caribbean nations has been to encourage lionfish hunting, with tournaments, culling programs, and even campaigns to make lionfish a popular food fish. The meat itself is completely safe and reportedly delicious. The venom is only in the spines, and cooking destroys it entirely. Most people who interact with lionfish in tourist destinations are warned. Dive briefings cover them, signs are posted, guides point them out. But local fishermen in the Caribbean and Gulf of Mexico encounter them daily, often without protective gear. They reach into traps, they untangle nets, and they get stung, sometimes repeatedly. Repeated stings do not build immunity. There is no tolerance that develops. Each sting delivers a fresh venom load, and the reaction can be just as severe the 10th time as the first. Children and smaller individuals face greater risk from the same venom dose relative to their body mass. And anyone with heart conditions, allergies, or compromised immune systems faces elevated danger from what might otherwise be a manageable sting. So, what happens to your body after a lionfish sting? In the first 30 seconds, explosive, radiating pain unlike almost anything else the ocean can produce. In the following hours, tissue damage, swelling, potential infection, and in serious cases, cardiovascular effects that require medical attention. In the days and weeks after, most people recover fully. The pain fades. The swelling goes down. The wound closes. But the fish that caused all of it moved on. Unhurried, unbothered. Still fanning those gorgeous, lethal fins for the next thing that gets too close. The lionfish does not need to be the fastest predator in the ocean. It does not need to be the most venomous creature in the sea. It just needs to be exactly what it is. Patient, beautiful, ishki, and armed with something your body was never designed to handle. If this video changed how you think about what lives beneath the surface, subscribe. There is a new creature waiting for you every week, and some of them are far stranger than this one. Next time, we go even deeper, and the animal waiting there makes the lionfish look like a beginner.